I have another IV skill to demonstrate for you. This is an IV piggyback medication that we're going to calculate and administer the medication at the correct rate through an INT that's already existing. So I have already pre-primed my IV tubing, and remember that we've already checked and we have the correct medication, and at this point we need to calculate our rate of administration, and we want to use our drop factor formula. So be sure to look at your primary tubing set, and the drop factor is listed here. This is 10 drops per milliliter, so this is going to factor in to that formula that you have. So I've established my drop factor that I'm going to administer, and be sure that you state on your video how many drops you're going to let fall every 15 seconds. So now I have my medication and I have my flush, and for this skill you only need 2.5 milliliters flush before and after. So I'm going to go to my patient's room. Don't forget that you still need to follow your rights of medication administration and identify your client with 2 separate methods. I'm going to go ahead and hang this solution here. This is my IV piggyback medication, and it's correctly labeled. And I have my flush. I want to inspect my site just like I have with every IV skill that I've done. I'm going to unclamp my extension set here. I'm going to swab my port on my INT. I'm going to disconnect this cap. Whoops, I'm sorry. Back up one step, I'm sorry. I need to flush at this point. So I've removed my cap. I'm going to flush with 2.5 milliliters of flush. Unclamp my extension set. I'm going to flush with a smooth and steady flush here with my saline, 2.5 milliliters. I'm going to lay that right on my alcohol. Now let's uncap that tubing, and we're going to connect here. At this point, this is where I need to use my roller clamp, and I'm going to calculate my drops per minute. I'm going to calculate how I'm going to watch drops fall for 15 seconds and adjust my rate using this roller clamp. Once that infusion has completed, I will need to stop my infusion. This bag should be empty. I'm going to disconnect my primary tubing, because when you infuse IV piggyback through an INT, you set it up just like a primary. So I no longer need this. I'm going to swab my port with a clean alcohol, uncap my flush, and I'm going to flush this INT using a slow, steady push for the saline flush. And at the end, I want to be sure to reclamp my INT extension set. Remove my flush, discard my syringe in the sharps container, wash my hands, and document appropriately.